We stand at a pivotal moment in the evolution of how we manage valvular heart disease across the spectrum of cardiovascular medicine and surgery, with new therapies transforming the way we care for patients. Hello, my name is Vinay Badhwar, and in this series, I hope to guide you through one of our most significant changes, the movement away from traditional sternotomy or open heart surgery and the use of transcatheter therapies outside of guidelines towards the promise of minimal access and fully robotic heart surgery. I'm a cardiothoracic surgeon with a subspecialty focus in heart valve therapy, performing thousands of operations over the last 25 years. I am so blessed to have an incredible team here at the West Virginia University and the WVU Heart and Vascular Institute. I want to share what we have learned performing more than 1,000 robotic heart operations. To my outstanding heart surgery colleagues around the world, my hope is that this series will serve as a toolbox for those who want to learn the core principles of robotic heart surgery and then move onward to more complex procedures, such as complex mitral valve repair and even multi-valve and atrial fibrillation operations. And I'm especially excited to share a procedure our team here at WVU developed, known as the right lateral transaxillary robotic aortic valve replacement, or RAVR. Whether you're just getting started with robotic surgery or you're looking to level up, these cases, including many firsts in our specialty, will give you options for tailoring treatment to the specific risks and realities each of your patients face. To our cardiology colleagues, perhaps this will serve to highlight what is possible as we evolve our well-functioning heart teams and enhance access to robotic heart valve surgery as well as transcatheter alternatives to traditional therapy. To any patient or family member watching, please note that access to robotic heart surgery is accelerating rapidly, and my hope is that one of my excellent colleagues around the world will be able to care for you nearby, wherever you reside. This series is not meant to substitute for the most important and direct knowledge you will gain from your own surgeon and your own cardiologist. Finally, I speak to you with no ties to industry, no influence from companies, and especially this series is being produced with no financial remuneration whatsoever, only with a commitment to give back to our patients, the specialists who serve them, and the specialty that has served me so well. So on behalf of our remarkable team at West Virginia University, I'm honored to present this multi-part series on advancing in robotic heart surgery.